Peripheral venous catheterization. In medicine, a peripheral venous catheter, a PVC, or a peripheral venous line, it's a catheter which consists of a small flexible tube which is placed onto a peripheral vein for intravenous therapy, for example, for blood drawing, or for intravenous medication or intravenous fluid therapy. A peripheral venous catheter is usually placed in a vein on hand or arm. Usually it's placed distally so that it allows the patient to move freely. It should be distinguished from a central venous catheter in which the venous catheter is placed in either internal jugular vein or subclavian vein in the chest. These are usual sites of catheter placement. The most common site is the hand. However, if there are any contraindications at this site, we may use saphenous vein in the leg. In babies, in infants, the superficial temporal vein is used as superficial venous access. For that matter, even it can be any scalp vein. Indications for peripheral venous catheterization are repeated blood sampling, IV administration of fluid, IV administration of medications, chemotherapeutic agents, nutritional support, and blood products. Contraindications are infection at the site of insertion, phlebitis, sclerosed vein, previous intravenous infiltration, burns or traumatic injury, proximal to insertion site, arteriovenous fistula in an extremity. So the procedure of insertion: assemble necessary equipment and don sterile gloves. Let's take a look at the equipment used. Here it consists of the needle surrounded by the catheter. Catheter is the flexible tube around it. So here this is the bevel. Here this is the transparent catheter hub. It consists of a safety lock mechanism inside, which has a push-off plate. This is the flash chamber where the blood will pool in once the catheter has been successfully inserted into a vein. Here this is an IV plug or vented flash plug which can be removed, and the IV line can be inserted. Some of the catheters may even have a dual lock system. Here this is a safety clip. When the needle is withdrawn, this safety clip closes and prevents damage by the bevel of the needle, or it also prevents reinsertion of the bevel. The mechanism works in such way. The nurse will apply tourniquets around 3 to 4 finger breadths above the site of insertion, and ask the patient to work their hand. They will clean the site of insertion using an antiseptic solution. The cap of the catheter is removed. The patient's hand is fixated by non-dominant hand, and the skin is pulled around cord to fixate the vein. The needle is inserted at an angle of 15 degrees. So 15 degrees. Because the vein is very superficial, once it hits the vein, the blood pools in a flash chamber. Advance the needle parallel to the vein and fixate the catheter hub with non-dominant hand, and while advancing the catheter, start to gently withdraw the needle. Release the tourniquet and withdraw the needle completely. Once the safety mechanism is in lock, we prevent reinsertion of the needle. The reinsertion may damage the catheter and cause an artificial embolus. It also prevents damage to the staff as well as the patient. Attach the IV line. If it's preferable to use a saline flash before attaching the IV line, and then fixate the catheter with transparent dressing and an additional fixating clip. The IV line can be begun now. Remember to record the procedure, the date, and the initial of the person who installed the catheter. Thank you very much.